Hi, I'm John DeSciullo. Welcome back to What's the Buzz in Western New York. On a previous edition of the program, we met Kathleen Velasquez, and we talked a little bit about what Kalos Health is all about. We're continuing that discussion now from the Kalos Health facility at 2424 Niagara Falls Boulevard. And Kathleen, welcome back to the show. Kalos Health, define it because it really is an insurance company. We want to make sure everybody understands that piece of this.
That's right, John. So Kalos Health, again, was founded in 2014, and they're a health insurance company. So we process claims and we provide health insurance coverage to a special population within Western New York. And we service Medicaid and Medicare individuals in the Western New York region.
So Kathleen, tell me what the eligibility factors are for an individual who would like to enroll in the Kalos Health Gold Plus plan.
The eligibility factors are an individual needs to be 21 years of age or older. They need to have Medicare Part A and Part B and be eligible for full New York State Medicaid benefits and live in one of our 4 counties, which are Orleans, Niagara, Erie, and Cattaraugus.
So we're heading into 2020. What are the new supplemental benefits that the Kalos Health plan will provide?
So for 2020, we have a couple of new benefits that we're really excited to be offering our members. One of them is a food benefit card that will be given to our members with $20 a month that they'll be able to use to purchase healthy and nutritious foods like fruits and vegetables, milk, eggs, dairy, meat products, things of that nature. And there's a catalog that will be provided so that they know exactly what items that this $20 will cover. And that $20 will be available to them every single month. And then the other new benefit that we've introduced is a social transportation benefit or transportation for non-medical needs. So with plan-approved locations, individuals may be able to go to the pharmacy, the grocery, banking, go get a haircut, things along those lines. And we're authorizing 8 round trips per year for our members to be able to do some social transportation aspects.
If someone's unsure of their status, their financial eligibility for the coverage, how does Kalos help direct them to make sure that they're going in the right direction?
So there's a number of different ways. So when the individual contacts the plan and they call our call number, they will put them in touch with a licensed Medicare agent. That licensed Medicare agent reviews all the qualifications to be eligible for our plan. If an individual, for example, doesn't have Medicaid, but we suspect they might be eligible, we can put them in touch either with our social worker or put them in touch with the local county Department of Social Services and help them get that application process underway.
If someone is eligible, but their primary doctor is not in the Kalos Health Network, how does that work?
So there's a couple of things that we can do. What we've done with some members is we've reached out to the primary care physician and offered them to become in network with us and sent them a contract. And a number of the physicians actually do join our plan. We have a vast network of doctors and hospitals for our members to choose from. But in addition to that, if the member isn't really tied to their PCP, we can help them make a selection if they really want to transfer to our plan and choose a different PCP that is amenable to their area.
What could the cost savings look like for a plan member who may be looking to leave a plan that is charging them a monthly premium?
So that would depend. Some plans charge anywhere from $25 a month upwards of $150 a month for a premium. When you're a Medicare Dual Advantage plan, when you're in a Medicare and you have Medicaid, you really should be able to be in a plan that has a $0 premium. So it depends on what type of plan a member's in. If they're in a straight up Medicare Advantage plan, individuals that have Medicare and Medicaid really should look at options for a Medicare Dual Advantage plan. Most Medicare Dual Advantage plans are offered at a $0 premium, and that's exactly what Kalos Health Gold Plus is. It's a $0 monthly premium, so it's no cost to our members.
So I know recent studies say that 30% of a person's well-being is really determined by genetics. Tell me about the other 70%.
Well, food insecurity is a leading factor for individuals going to the emergency room, for example. We find out that across the country, individuals are traveling to the emergency room, maybe not so much for an ailment, but really because they're hungry. So we want to address food insecurity. Another area that Medicare and Medicaid has been looking at is in social isolation and individuals with loneliness and depression. So part of our offerings has been to introduce benefits that can address those social economic factors that people don't traditionally think of as impacting on their health. And there's environmental factors too. So when you couple all of that together, they're affected by social, economic, and environmental factors. And so as a health insurance company, we're trying to step outside of that proverbial box and think about what we can do to add benefits and relieve some of those factors and help individuals improve their health.
So Kathleen, let's talk about the open enrollment period. At some point that will end. But the question now is, are there any restrictions for someone to enroll in the plan or switch from another plan to join Kalos, even if that open enrollment period ends?
So for individuals that have Medicare and Medicaid, they can enroll year-round in a Medicare Dual Advantage plan. There aren't any restrictions for them to enroll. There are some lock-in periods that individuals that they may not be able to switch as often, but they still are able to make changes within their plans to go to another Dual Advantage plan.
So Kathleen, what advantages do the new benefits have for the individual that is signing up for Kalos Health?
By delivering new benefits that address non-medical factors to overall health, Kalos Health is committed to supporting members throughout the Buffalo-Niagara region as they seek to preserve their independence. We want them to enjoy a better quality life and reach their health goals, and we feel that by providing these extra benefits, supplemental benefits of the over-counter card, the food benefit card, and the transportation for non-medical need, we're taking that step in the right direction. And as we continue to grow as a plan, we hope to further enhance these benefits down the line in the future for our members.
Thanks, Kathleen Velasquez from Kalos Health, for joining us here on What's the Buzz. If you would like more information, you can go to the website, kaloshealth.org, and there's a phone number to call. It's 1-800-399-1954. The Kalos Health team of professionals will make this easy for you. Make sure you go online, find out everything you need to know, and give them a call. They'd be happy to talk to you. 1-800-399-1954. And find out if the Kalos Health Gold Plus plan is right for you.